Hey mamas, and welcome to the Entering Motherhood podcast. I'm your host, Sarah Marie Bilger, a wife, mom of two, VBAC mama, and doula. Here we integrate holistic mindfulness and evidence-based practices to support you on your unique motherhood journey. Whether you're trying to conceive, pregnant, newly postpartum, or supporting mamas in this stage of life, you'll feel empowered and informed as you embrace what lies ahead. Join us every episode to learn from professionals, special guests, and moms just like you, ensuring that you know what you need to know and discover things that you didn't know before. I believe in you. Let's doula this and let's navigate the transition of entering motherhood together. Hey mamas, today we are diving into a topic that's incredibly important for expecting mothers and one that's been pretty relevant for a few of my clients recently, and that topic is blood pressure in pregnancy. So whether you're currently pregnant, planning to be pregnant, supporting someone who is, this episode is just packed with essential information that you won't want to miss and is really great at helping explain what goes on when we have blood pressure readings in pregnancy and what that can mean in different scenarios. So let's start off with exactly what is blood pressure and why it's so critical during pregnancy. And essentially, blood pressure is the force of your blood pushing against the walls of your arteries. So when you're pregnant, keeping an eye on your blood pressure is really vital because it can signify, impacts on both your health and baby's health. So starting off with the basics, blood pressure readings have two different numbers. The systolic pressure, which is the number on top, and the diastolic pressure, which is the number on bottom. The top number measures the pressure in your arteries when your heart is beating, and the bottom number measures the pressure when your heart rests between beats. In non-pregnant adults, normal blood pressure is somewhere around 120/80. However, blood pressure can fluctuate during pregnancy, and understanding these changes is super key in ensuring a healthy pregnancy. So in the first trimester, you might actually notice that your blood pressure is dipping a bit. And this is typically due to a lot of hormonal changes that cause your blood vessels to relax more. But by the time you hit maybe your second trimester, your body is really starting to adapt to that fluctuation in hormones, and your blood pressure might actually start to creep up again. Then by the third trimester, it's normal for your blood pressure to rise somewhat because your body is working really, really hard to support a growing baby. So knowing what is normal blood pressure range for your body specifically is super important here because we might have fluctuations, we might have different things going on, but if you're normally kind of on the higher end or lower end, then this trend might continue or be more drastic throughout pregnancy. So it's just something to be aware of and know what's normal for your body, not necessarily what is occurring typically. So I first want to start off by saying that most of the time when people hear blood pressure in pregnancy and different things that are occurring is normally associated with high blood pressure. But I want to talk about low blood pressure for a second. And with low blood pressure or hypotension, it's also common during pregnancy, just as common as high blood pressure, and it can cause, its own set of issues during that time. So during the first and second trimester, like I said, maybe it's lowering a little bit and your blood pressure might be lowering, like I mentioned before, because of hormonal changes, but it can also lower due to circulatory system changes, and your circulatory system is expanding rapidly, and it's doing that to accommodate the growth of your baby. So common symptoms for low blood pressure is going to look more like dizziness, fainting, fatigue. Most cases, low blood pressure during pregnancy is things like that. And then, so in most cases, low blood pressure during pregnancy isn't as concerning as high blood pressure, but it can still affect your day-to-day life and, your overall well-being. So this is something to look out for as well. If you're feeling dizzy, if you're feeling fatigued, it might be related to blood pressure. So a few things that we can do to help manage low blood pressure is just changing a few things slightly. So a few things that I feel are important to be aware of when it comes to low blood pressure is keeping up with hydration, making sure that you're drinking plenty of fluids to stay hydrated. Ideally, we want this to be water and adding in some electrolytes, but in whatever form you need to be staying hydrated in whatever stage you're at, really just making sure that you're getting plenty of fluids. And then also what can help is eating small, frequent meals. So actually eating smaller meals more frequently can really help prevent those dips that people see in their blood pressure. And so if we're, spacing out our meals throughout the day, maybe we're not getting as lightheaded and dizzy, and we're really just making sure that those dips aren't happening and that our blood pressure is staying consistent. Another thing that can be super helpful is just how you move your body. Keeping your movements slow can be super helpful. So, if you're used to working out and you're going and doing, really intense, quick movements, and this is making you feel dizzy and lightheaded, maybe just slow it down. Listen to your body and listen to, how you're feeling and what's going on. Be careful with standing up too quickly. If you are standing up and changing your position and getting really lightheaded and dizzy, this could be related to a lower blood pressure. So really just, slow down, take it easy, watch when you're standing up or laying down, things like that, and just take things slow. Then the last thing I want to point out with low blood pressure that can be useful is compression socks. And they can be a great tool to use here. These can really help improve circulation and prevent blood from pooling up in your legs. And it's really beneficial to avoiding that low blood pressure symptoms that might be occurring. And then also just keep in mind, if you're experiencing very severe symptoms or have concerns about your blood pressure, it's obviously super important to consult your healthcare provider for personalized advice. So I'm really just pointing out things from a doula perspective and saying, what I've seen, what's been helpful, what can occur, but you know your body best. Your healthcare provider can evaluate you more on a personalized level. And so really kind of utilizing that to your benefit. But if you're kind of, like I said, like lightheaded, dizzy, maybe just point that out and say, like, could it be related to my blood pressure? Are you having lower blood pressure readings? Is that occurring? Maybe try to do some of these things or talk with your provider about incorporating some of the things that we're discussing here. So now leading over to hypertension or high blood pressure, this is something, like I said, that has been occurring with some of my clients more recently. Actually, my past 3 clients were showing signs of high blood pressure and needing to be looked at on a deeper level. And for them specifically, it was something that was showing up later in pregnancy as things were progressing. And with that, there are different types of hypertension that we can be talking about. So chronic hypertension is blood pressure that exists before pregnancy, or it's diagnosed before 20 weeks of gestation. So if you have high blood pressure and this is something that you experience already before you are pregnant or before you got pregnant, then that is chronic hypertension. Then there's gestational hypertension, which is high blood pressure that is developing after 20 weeks gestation. And with that one particularly, that's concerning because it can lead to preeclampsia, which is a condition marked by high blood pressure. That's number one sign. And there's also signs of damage to another organ in your body. Most likely, this is going to be your kidneys. So that's why high blood pressure is a lot more concerning and something to really just be looking into and keeping track of. True high blood pressure during pregnancy does have the ability to cause some serious situations for, not only mom, but baby. And it's really important and helpful to be paying attention to your blood pressure readings. And that's why most likely you'll be getting blood pressure readings checked every single one of your appointments. So this is, you come in and they check your weight and your blood pressure and your measurements and, ask how you're doing and things like that. So blood pressure is typically one of those things that is checked at almost every single one of your appointments. And some of those complications can be, it increases the risk of stroke, organ damage, and even cardiovascular diseases for mom. And then for baby, it can cause preterm birth, a lower birth weight, or placental abruption. And so placental abruption is one thing that did occur for one of my most recent clients. And so they were experiencing high blood pressure, they were experiencing, back pain, they were experiencing different sorts of things that it was suggested to move forward with induction. And it was later confirmed and determined that they did have placental abruption. And placental abruption is when the placenta separates from the uterine wall just too early, which is not good. The placenta is a source of blood and oxygen for baby. And so if that is detaching, then baby is not receiving as much blood and oxygen as they need. And obviously that can lead to further complications if the placenta were to completely detach. So with high blood pressure, some symptoms that you might be experiencing would be very persistent headaches, maybe changes in your vision, like blurred vision. You might be having some upper abdominal pain, and there could be very significant swelling in either your hands or your face. However, some women might not have any symptoms at all. So this is, again, why it's really important to be monitoring your blood pressure. And typically, providers are going to be diagnosing hypertension based on those regular blood pressure checks and sometimes additional tests like testing your urine for protein, having other blood tests done, and even sometimes there is fetal monitoring being done just to ensure that baby is doing well. So one thing that you can do also is get a blood pressure cuff to measure your blood pressure at home. This is something that one of my other clients had done, and it was actually suggested to her from somebody else who was having blood pressure situations. And so she had gotten a cuff and was taking her blood pressure at home, as well as seeing what the results were in the office. And sometimes this can be really beneficial because you can have elevated readings at the doctor's office, and then when you're home and you're relaxed and you're not in that sort of setting, they can be drastically different. So if this is the case, then that's something that you can bring up with your provider. Like, hey, I know when I come into the office, I'm experiencing these high blood pressure readings, but then when I go home, they're a lot lower. What might be happening here? Is this true hypertension? Can we be evaluating it differently? And ultimately, again, like really just understanding your body and what you're feeling and what you feel is the right path forward. So the good news is with hypertension, there are ways that we can really be managing this and preventing high blood pressure from occurring during pregnancy. So this might be something that maybe you don't have high blood pressure. Your blood pressure is pretty, regulated, but you want to make sure that we're not getting to that point and having high blood pressure readings. So you want to take more of a preventative approach. And there is a lot of controversial information out there for this, one of them being sodium intake. A lot of people say it can be helpful. A lot of people say it can be harmful. And really just adjustments in your diet can always be very fluctuating and hard to predict because we're all different. We all experience things differently. And some things might be super beneficial for one mama and also be not so great for another. So really just kind of seeing if you make that adjustment, does it alter anything? Does it make things better? Continue with that, obviously, if it's beneficial, and maybe not do that if it's not helping you. But overall, one thing that can be super beneficial is moderating your exercise and really keeping your body moving and having some sort of consistent routine, because that is helping your blood pump, it's helping your blood flow, and it's usually helping you maintain a healthy weight before and during pregnancy. So that can usually make a very significant difference when it comes to high blood pressure. With that being said, though, I've known people that are extremely active and very physically fit and still have high blood pressure situations. So again, just knowing your body and knowing what's normal for you and really just taking everything one step at a time as it is occurring and as your pregnancy is progressing. I specifically love Lily Nichols. If you haven't heard of her, please go look her up. I will drop some information in the show notes about her, but she really does a great job of cultivating a lot of research and releasing this information to help throughout pregnancy and even postpartum, even fertility. I love just really soaking up all the information that she is able to obtain, and she specifically goes into nutritional support. And there is a blog article that I will specifically link, and it is 5 ways that nutrition supports blood pressure. I'll put that in the show notes, like I said, and I have, some of her books, and I really connect with her on that nutritional level. And essentially in the article, she points out to be focusing on eating real whole foods, choosing colorful fruits and vegetables that are high in antioxidants to help reduce oxidative stress, and also making sure that we're prioritizing our protein intake and incorporating foods that are high in choline, like liver and eggs, and then really making sure that, like I was saying before, like making sure that you're hydrated, but maintaining your minerals such as sodium and calcium, magnesium and potassium. And she also points out making sure that we have high quality carbohydrates and reducing your intake of refined carbohydrates and added sugars. So that's just a few things that are in the article. It's a really great resource to have and look over, but that is something that you can look at. And another thing is that, a lot of other doulas might recommend is the brewer's diet, which that essentially is, again, like making sure that you have that high protein intake, salt, veggies, mostly green veggies, whole grains, fats, and vitamin-rich foods. And so looking into these nutritional aspects and seeing if that's something that could be beneficial to reduce your high blood pressure is always going to be helpful. So taking those into account and maybe checking those out and doing a little bit of research. I'll link some stuff in the show notes that you can look at for yourself and see if this is something that is going to be beneficial for you. Like I was saying before, in some cases, there may come a time when your provider is starting to consider an induction because of what they're seeing in your blood pressure readings. So it's typically suggested that when your blood pressure is consistently seeming to be above that 130/80 range or higher, then this, and it's not being managed throughout other methods, and you've tried all the things and you've done all the things, and you're still getting these high blood pressure readings, it's usually a time when providers are going to start suggesting induction. So managing high blood pressure during pregnancy involves making some tough decisions, and one of those tough decisions might be deciding to induce your labor. And a few reasons of why induction might be necessary due to high blood pressure and why you might want to consider it would be because high blood pressure can signify severe preeclampsia or eclampsia. And if you develop this severe case and you're experiencing symptoms like not only high blood pressure, but very severe headaches, they're noticing that there might be some organ damage or other things are occurring to really kind of signify those signs of preeclampsia. Induction might be necessary to protect both your health and your baby's health, because the solution to this is getting your baby out and no longer being pregnant. So that might be a really great reason of why induction might be beneficial for you to still be able to have a vaginal delivery. Another reason induction would be beneficial is because you're just not able to control the hypertension. Your blood pressure is remaining high despite medication or different lifestyle changes, and just having this high blood pressure can really create multiple different risks. So to prevent further complications and increase those risks, then induction might be a good solution to resolving this issue and having, that healthy mom, healthy baby situation. So another thing to really be aware of when it comes to high blood pressure is also considering if there are any fetal complications, if there are signs of distress with baby during pregnancy and during labor. So if meconium is occurring, if heart rate is decelerating, if baby is not growing as expected, these can all be signs of fetal complications. So inducing labor can really help ensure that the baby receives necessary care as soon as possible while still giving you that, again, vaginal delivery if that is what is desired. Obviously, cesarean can occur and you can bypass the vaginal delivery if that is something that you are considering as well. But if you are hoping for that vaginal delivery, it's still very much possible. But having some form of induction might help in these cases of gestational hypertension, even chronic hypertension situations. So for these cases, induction might be recommended usually around that 37 to 39 week mark to help reduce any increased risks of complications to further progress in your pregnancy. So you and your healthcare provider should have a very deep discussion. Your healthcare provider should be able to walk you through the risks and benefits of induction with you based on your specific situation and your current stage of pregnancy that you're experiencing. So it's super important to have a very thorough discussion with your provider and go over the best course of action moving forward for you and your baby. And in this discussion, you're really aiming for all of your questions answered and a decision to be made that you feel confident in, that is the best path forward for what your goals are. And one aspect I will say of inductions that I've seen to be super beneficial is if you are planning on having an induction and that is the course that you're taking and you still have some time, then considering getting steroid shots beforehand can be super beneficial because this is going to help better develop your baby's lungs, and that can make a huge difference if they are being born early. You know, that like even 37 weeks, 38 weeks, 39 weeks, any amount of time that is before their due date, the lungs are the last thing to fully develop for baby. So having these steroid shots can help develop their lungs and make them stronger even if they are preterm. So with all of that being said, in this whole episode, it's really important to point out that some pregnancies can come with higher risks. For example, if you're carrying twins, this can increase the risk of hypertension. If you have pre-existing conditions like diabetes or kidney disease, it really is important that we're managing blood pressure and just being aware of it and really taking that into consideration so that we're not having more critical situations occurring. And also, we have to look out for postpartum situations and really consider what happens after baby arrives. Blood pressure issues don't always disappear immediately, and some women may develop postpartum hypertension or really just continue to have high blood pressure even after delivery. So it's important that you're continuously monitoring your health afterwards as well, and following up with your doctor and really taking into consideration any symptoms that you're feeling or things that are occurring so that you can really help manage any long-term risks that could occur. So again, just to wrap up everything, when it comes to blood pressure, it's super important to be monitoring that blood pressure during your pregnancy, and it's really critical for both your health and baby's health. And then understanding the changes in blood pressure and recognizing what symptoms can occur with hypertension, hypotension, and knowing what that normal range is. Again, that, 120/80, and watching out if it's going above 130, if it's going above 90, really being aware of how your body is feeling and if those numbers are escalating. And obviously, attend all of your prenatal appointments as best as possible to really be keeping track of this, or like I said before, also having your own personal blood pressure cuff reading so that you can be evaluating it on a personal level and taking that into consideration and tracking it yourself. As always, my hope is to really just better explain some of this information and go in depth so that you're informed and that you can have a meaningful conversation with your provider, or what you're looking out for when it comes to this information, and you are able to make informed decisions throughout your pregnancy so that you're feeling empowered along the way. So if there are any other topics that you would like to hear more about or have me go into more detail with, please feel free to reach out to me and message me. You can reach out to me on Instagram. You can go on our website. There are multiple ways that you can get in contact with me and really just further this conversation and let me know what you are experiencing throughout your pregnancy so that we can be informing you and helping you make informed decisions. I'm super excited because we do have plans to have a full in-depth childbirth education course coming out, and it's really going to go over topics like this to help educate you so that you know what you don't know and you feel really optimistic about what's to come as you progress in your pregnancy and beyond. So make sure to be following me on Instagram, be listening to the podcast, be subscribing, because there are more things to come and more things to look out for. So thank you so much for being here. I hope you gained some insight from this episode, and I'll see you later, mamas. Thank you, mamas, so much for listening. Remember, you are a rock star. I believe in you. Let's doula this. Let's crank it up a notch and let's kick it into high gear together. Hit that subscribe button, share this episode with a friend, message me, email me, call me, beat me. You know how to reach me. We're doing this, mamas. I am so excited to catch you here next week. This is your one-stop go-to place for helping you find the resources you need to make the best choices for you and your family during pregnancy, birth, and most importantly, postpartum. See you later, mamas.